Hey friends, let's talk about results of biopsy. So you went to gastroenterologist, did endoscopy, and results of biopsy are here. Every single word is important, and you will understand why in a second. Now, intestinal metaplasia means that some insult happened to stomach, and the normal stomach cells get substituted with the cells either from the small intestine or from the large intestine. Gastrointestinal metaplasia means that esophageal cells get substituted with the cells from the stomach, and it's called Barrett's esophagus. You need to act now. It's more aggressive condition. What factors will contribute conversion of metaplasia to cancer? Older age, male gender, H. pylori definitely, family history of the gastric cancer, bile reflux, smoking, alcohol, high salt intake, diet low in fruits, vegetables, and vitamin C. If you see on the biopsy report word dysplasia, act now. Yes, there are different types of dysplasia. However, report shows that progression to gastric carcinoma is reported in 60 to 85% of the cases within 4 to 48 months. In case of low-grade dysplasia, the risk is low. This is important. Overall, risk of gastric cancer in patients with metaplasia is extremely low compared with the risk to adenocarcinoma in patients with with Barrett's esophagus. So act now. This slide is represent formation of the cancer in the stomach, and the theory is old. So I learned it in medical school, and it still stands. In the presence of insult to stomach, gastritis gets formed. Insult continues, atrophy takes place. Insult continues, metaplasia gets formed. Insult continues, dysplasia, and then eventually cancer. So treat things, treat gastritis, treat metaplasia. Now, when you read biopsy, you see these words, focal or extensive. Focal means that metaplasia is very small. Extensive means big. Obviously, it's worse than focal. Complete and incomplete. Complete metaplasia means that the cells from the small intestine present. Incomplete from the large intestine. Location is important. Usually, if it's located in the antrum or laser curvature. And here is the picture for you that you will understand. So here is the stomach. This is the laser curvature. This is antrum. This is a part of the stomach. And if it's located in the part of the stomach, obviously it's worse. Now, factors that contribute to formation of metaplasia. You know that it's insult. How severe the insult to stomach? The more severe insult, obviously, the higher chance to form metaplasia. How many different irritants affect the tissues? How long? The time is important. If insult lasts to irritant like for 1 year or for 10 years, obviously 10 years is worse. If there is a genetic predisposition, acid reflux also contribute to metaplasia. Bile reflux, H. pylori definitely can create metaplasia. Smoking, alcohol, environmental pollution such as herbicides, pesticides. Now, inflammation in other parts of digestive tract. Somehow people assume that stomach, small intestine is just different pipes. No, its digestive tract is one pipe. If one part is affected, such as, for example, small intestine or large intestine with constipation, inflammation develops, and inflammation travels from the bottom to the top. So even constipation needs to be dealt with. Now, you're looking at the result of biopsy from a person. I suspect the gastroenterologist saw the polyp in the greater curvature and took the polyp, and this is description of the polyp. And also there is a mild chronic gastritis there. H. pylori is negative for intestinal metaplasia, dysplasia, or malignancy. Kind of okay. Antrum. arterial type mucosa with mild chronic gastritis, severe intestinal metaplasia in features of reactive gastropathy. Helicobacter pylori is negative, negative for dysplasia and metaplasia. Kind of like, nah, it's okay. Here's the different report for you. Duodenum. Unremarkable duodenum mucosa, no evidence of celiac disease or parasites. Antrum, we are talking about stomach now. Acute erosive gastritis, minus, with incomplete, minus, intestinal metaplasia, negative for H. pylori, is positive for intestinal metaplasia, obviously, negative for dysplasia. Body, mild chronic inactive gastritis, H. pylori negative, negative for intestinal metaplasia. Okay, so if you compare those two, the first is a little bit better than the second one, than this one. Okay, so this is the summary. Okay, so okay, metaplasia, when description is focal, means very small, complete, means from small intestine, and located in the atrium or laser curvature. Metaplasia is worse if it's extensive, big, incomplete from the cells from the colon, and located in other parts other than antrum or laser curvature. Plus think about the other factors that may, exacerbate intestinal, may contribute to gastritis and intestinal metaplasia. Age, and by the conversion of intestinal metaplasia to cancer. Age, dysplasia, years of pain, family history of gastric cancer, alcohol, smoking, environmental pollution if present. Okay, so if that's the case, incomplete or extensive metaplasia start to act now. I'm done. If you have any questions, please ask me there. I will either make a video or send you a link to other video on my YouTube channel. Thank you very much. Bye-bye.